Good night, everyone. Thank you for tuning in to having a conversation with Zay. I'm so happy tonight to have my tonight just to talk about debunking the myths of menopause for Black women and the Caribbean diaspora. And tonight I have a nurse practitioner that can come out and just explain the details about menopause. So I'm gonna just give you a little bit about her background and we'll go into the show. So Miss Terryan Douglas is an ARNP, a Dow Board certified family nurse practitioner. Beginning as a CNA at 16, she advanced to an LPN, then an RN, and working across diverse healthcare settings in New York and Florida. While earning her master's degree at Barry University, she worked as an nurse, open heart nurse before transiting into a clinical research, leading studies to cardiac devices and treatments. Now primary provider at a Veterans Administration in Washington. She also owns Top Tier Nursing Services, a wellness practice featuring her disconnect and reset treatment, a holistic escape offering a farm to table meals, yoga, meditation, and workshops to combat the burnout and enhance the fertility. So tonight, everyone, welcome Miss Terryan to the platform. How you doing, Miss Terryan?
Hello, everyone. Good afternoon. Thank you for that wonderful introduction.
You're welcome.
As Zay said, my name is Terryan. I'm a family nurse practitioner. I've been in the healthcare space since I was 16 years old. So, I'm still 21, so I'm new to So 20 something years later, tons of experience. I graduated high school as a certified nursing assistant in Long Island, New York. Then I went to VEEB, was an LPN program. I did that also in Long Island. I moved on to getting my associates at Helene Fold College of Nursing in Harlem, New York, 120th and Madison. Then I went on to my bachelor's and my master's at Barry University in Miami. I've been a nurse practitioner now since 2017. I have a heavy cardiology background. I work with adults, and I get access to amazing people. I have patients from the homeless to the multi-millionaire patients, and humans are humans, and I love what I do. I also facilitate wellness retreats, and that's what Zay was telling you about. My retreat started in Jamaica. It's 1 week away at a beautiful space that I choose. I have a full staff with a chef. We have our private chef, our private driver, and it's pretty much just a week away to rejuvenate and to recharge. The retreat is called Disconnect and Reset. So I just wanted to tell Zay, thank you for allowing me access to your platform and to get access to your people, to share what I do, and also to welcome you and my family at Disconnect and Reset. Yes. Today, our goal is to debunk the myths of menopause. I know a lot of us women are going through the change. Again, because we had the change at 12, 13 going into our menstrual cycle, and now we're going through another transition. So thank you, Zay, again for this platform, for allowing me to speak on this, okay?
Yes, you're welcome. That's what we're supposed to do, help and
educate. So before we touch on menopause, let's discuss the transition prior to menopause. So this is called perimenopause. I know there's a lot of a lot of information out there, and I just wanted to kind of simplify things and just explain from a medical standpoint what we do on the back end and how we come up with treatments and diagnoses. So perimenopause, it usually begins on the average of 4 years before your final menstrual period. So 4 years before the woman gets their last cycle, you're in perimenopause. On an average, this is 47 years old for most women. This change affects a number of physiological changes that can affect the woman's quality of life. So at this point, you may start to notice irregular menstrual cycles. And this is due to the hormonal fluctuations. Remember when we were teenagers and we were going into the change, into getting our cycle, we had those just irritability and anxiety and things that we couldn't explain back then. And now we know a little bit more. So it's a similar hormonal fluctuation, just a different spectrum. At this point, you may get some hot flashes, sleep disturbances where you're up at night and just your mind is just racing. You're wondering why. Mood symptoms, vaginal dryness, brain fog, palpitations, which are faster, harder heartbeats. I normally get patients in cardiology. Women will come in and they're like, hey, I'm having this faster, harder heartbeat, and they think it's something wrong. And a lot of these are symptoms from perimenopause going into menopause. We also notice some changes in your cholesterol, your lipid level in your cholesterol, and bone loss when we're transitioning into that perimenopause going into menopause. So under perimenopause, we have an umbrella. And again, it's a slow transition. So we call it an early transition and a late transition. So this is before you hit the big menopause. So in early transition, what happens is your cycle, your intermenstrual interval. So the time in between your next cycle expands. So normally when you're in your earlier years or early reproductive years, we'll have a cycle about every 25 to 35 days. And we'll just, your GYN will normally ask you, are your cycles every 28 days? We just kind of round it off halfway there. So that's a normal cycle for a normal woman that does not have PCOS or any other GYN issues. But once you get into that perimenopausal stage, you start to notice that the transition widens. So your interval between periods may no longer be 28 days. It could be 40 to 50 days in between the cycles. And that's how it normally starts, with all these little vasomotor symptoms, which are your hot flashes, and they may be subtle, but it's happening. The change is slowly happening. The late transition prior to the menopause. So you have your early and then your late transition. So after the period lengthens and the cycle changes, then women will notice a period of amenorrhea. Amenorrhea is a fancy word for no periods. So a month you may skip a period and you're like, what the heck, what's going on? You just skip a period. So you're having these moments of no periods, or these months of no cycles. And this transition period, the late transition period, can last 1 to 3 years. So this is about 3 years of you having this irregular cycle, and this can be frustrating. This can also look different for every woman. So your mother may have had a heavy period up until she was 59, but you at 45 start to have this irregular cycle. So we're all different, and it presents different in every woman. And why this happens is because of your hormonal levels. So what's happening in the body is that your FSH level, so your follicular stimulating hormone, is pretty much the hormone that your body secretes that speaks to the ovaries and tell the ovaries, hey, she's not pregnant this month. Let's make some more eggs. We're going to make some more eggs so she could get pregnant, right? So this now, it keeps pumping out more and more and more of this hormone.
Right.
And this is where you have this erratic change. And this happens from the brain. The pituitary gland is trying to compensate. because the brain is like, listen, she ain't pregnant. We need to make her pregnant, so we need to make more eggs. So this fluctuation now is what's causing this. So when we check your labs, when women come into the office and they're like, oh, doc, I think I'm going through a change in this, we'll do hormonal labs. And one of the main things we check for is the FSH, or the follicular stimulating hormone level. We also check your estrogen level, right? So these are our hormones. Again, during this transition, your FSH level, the follicular stimulating hormone, will be high because the body's trying to compensate. As we get older, the numbers will change. The hormone level will slowly decrease, but initially the FSH will be high. However, there's times when, depending on how the stars are aligned, because that's how the woman's body is, right? Depending on our mood, what we ate, our environment, our stress level, the FSH may be normal and the woman is still going through a perimenopausal state. So when you have a patient come in and they're like, they see you in primary care and they're like, my GYN ignored everything I said about my perimenopausal symptoms. She didn't check any labs. A lot of the times the labs can be misleading. So that's why we don't rush to check the hormonal levels, because your FSH can be normal even though you're perimenopausal. And why that happens, again, is just the nature. It's just the nature of the human body. So going into menopause now, natural menopause, permanent menopause. How do we diagnose menopause? Menopause is 12 months of amenorrhea, that fancy word again. So 12 months of no periods consistently. So if you had a cycle in January and no cycle now, for instance, February now, doesn't mean that you're not in menopause yet. You're still in perimenopause. After 12 months of you not having a period consistently, that's when you get the diagnosis of menopause, and it's official that you're in menopause. The first 2 to 6 years is referred to early menopause. So after that 12 months, following that, you're still in early menopause. So now you're talking about a woman in their 50s, right? The median age of menopause is 51.4 years old. I don't know where they got the 0.4 from, but I'll just round it off to 50 to 51. That's when, most women are in full-blown menopause or early menopause. The timing. We're all different. Again, we're all different. It depends on your genetics. It depends on your social history. Are you a smoker? Are you a heavy drinker? Also, your reproductive history. So some of us go through menopause earlier or later, depending on all those factors. Again, the FSH, the follicular stimulating hormone, that will stay high during menopause. And then as we age, the number declines. All right, so we spoke a little bit about symptoms that women experience during menopause, and I'm just going to expand on them a little bit, and then we'll wrap it up in a few minutes, and then Zay will take the stage and asking me some questions. So symptoms, the menstrual bleeding. Again, there's a gradual decrease in that, where it's inconsistent until it stops, and you'll skip months. However, some women experience heavy and prolonged bleeding. The human body is so complex. It's an amazing machine, but it's complex and it's flawed. So some women, they don't have those irregular periods. They have a heavy period every month, all the way up until their late 50s, and then it stops.
Right.
So everyone is different. The ones that have heavy bleeding usually are obese, or they have had fibroids. Sometimes we have fibroids and we don't know about it until later age, because they've been asymptomatic.
Right.
So that could be the reason why some women have heavy bleeding. Hot flashes. Hot flashes, we have another fancy word for that. Vasomotor symptoms. Vasomotor symptoms just pretty much means that you're having these waves of heat, like a heat wave that no one else feels but you. It feels like the heat is within. And a lot of the times they occur at night. So when women get them at night, they call them night sweats because you get a little sweaty. 80% of women will experience hot flashes. It is the most common menopausal symptom. And only 20 to 30% seek medical attention. So not a lot of women seek medical attention. And Zay has questions about that. So we'll dive into that at some point. The duration of these symptoms can last as long as 20 years after the final menstrual period. So that's another question I get a lot, where women are in their 60s and they're like, oh, my period stopped at 50. Why am I still having this? And I'm like, you're still in menopause. But my period stopped so long ago. These symptoms can last a long time. Right. So give yourself a little grace. How does this impact our lives as women going through this change? Women with 7 or more of these symptoms, like the night sweats, the hot flashes, the mood swings, and so forth, the lack of issues with concentration, interference with your sleep, they tend to seek medical treatment sooner. Women who it impacts their work, they end up getting a lot of absences because of heavy bleedings or mood issues. They get fired. Women that suffer from depression, that's another thing that happens. With the mood instability, you can go into different mood. You can actually develop mood disorders during menopause or perimenopause. I've even seen patients develop psychosis where they become like they lose touch of reality during menopause because of the symptoms they're having and the lack of sleep. Talking about sleep disturbance can cause so many other issues. Did you know that lack of sleep can lead to cardiac arrest? Yeah, lack of sleep can kill you. So, yeah. So after months and weeks of not sleeping, eventually your body will shut down. So that does happen, unfortunately. Then you have some women that have the GU symptoms and genitourinary, fancy terminology for the vulva, so the vaginal area. Sometimes it affects the bladder. So if mom keeps complaining of UTIs or she's always having problems with her bladder, a lot of this are due to the issues with menopause, the decreased estrogen. So your estrogen drops and that decreases the blood flow to the vaginal area, and that causes bladder issues. We also develop joint pain and aches. This normally happens with women who are obese. So it could be due to just because of the weight in the joints and arthritic changes as we age. Breast pain and tenderness is another one that usually happens early in the early transition. And some women get menstrual migraines, even when you stop menstruating. Some women every month they get those migraines because they have had migraines throughout their teenage years when they had a consistent cycle. So those are things that some of us experience as women throughout the process. And some women are lucky, they don't have anything, they don't feel anything. So we spoke about the hormonal fluctuation, and estrogen is a major player with the hormones as well. So as the follicular stimulating hormone decreases, your estrogen tanks. Estrogen is the female hormone. Just like men have testosterone, we have more estrogen. We're estrogen dominant, right? So once the ovaries stop working altogether, we lose that. We don't make any more estrogen. But the little testosterone that we do have as women, it's still there. So we're losing that, the protection of the estrogen. So estrogen is a major player with our heart and our bones. So once you start to lose your estrogen, this is where we start to see osteoporosis. Osteoporosis is brittle bones or weakening of the bones that happens as we age. And it normally happens or starts to present a year after our final menstrual period. Cardiovascular disease. So heart disease is due to increased lipids. Again, your estrogen tanks, you lose that protection from. Dementia. There's limited studies on that, but because of the brain fog and all the issues that we may have mentally and cognitively from the estrogen loss, there is a limited study that there's a risk of dementia when we lose our estrogen, or the risk is higher. We spoke about arthritis. Another thing a lot of us struggle with is gain in fat. So we are losing our muscle mass, but gaining more fat. And we're gaining fat normally around the belly area. So a lot of women complain of that. We lose our collagen from our skin. So the skin is not as pliable and moldable anymore. Right. We develop balance issues as well. And this is why exercise is important, because there's a risk for fractures when the bones are brittle, you're losing your balance and you're having joint pain and you're putting on weight, right? So those are things that can possibly happen long-term without the estrogen that we were born with. How do we evaluate a female patient that comes in with these perimenopause and menopausal symptoms? They use everything we do in medicine is evidence-based. We actually have people that do research on patients too, and I was one of those people that did in cardiology, that do research on patients, randomized studies to learn how the human body works and how different people respond to different things. So we use the STRAW staging system, and STRAW is a mnemonic for Stages of Reproductive Aging Workshop. And it's the gold standards that we use to evaluate women that are going through the symptoms, women over the age of 45 with symptoms of menopause, such as hot flashes and irregular periods. They're saying that there's no diagnostic test warranted. So this is why a lot of the times we don't check, because if you're having those symptoms, normally it's because of perimenopause. We also want to make sure that you're not pregnant. So a lot of the times patients get upset about this too. Like, I'm 50, she did a pregnancy test on me. If you're having these irregular periods, we still want to evaluate for thyroid issues. We want to evaluate for endocrine issues, hormonal issues. But majority of the time, your primary care provider or your GYN who knows you, knows your history, and will kind of tailor that to see if they need to check any labs. But a lot of the times we do just pretty much presume that the symptoms that the patient is having is perimenopause and menopause. So that gives a lot of information about the perimenopausal stage versus the menopausal stage. And from a medical standpoint, how do we come up with the diagnosis? And it gives you a clear idea as well as to what to expect and what to talk to your doctor about with your symptoms. So Zay, I'm opening the floor for you for any questions you may have.
That was a lot of information that I'm happy that you broke it down, because there's so much questions where women don't know what questions to ask the doctor, basically, or they don't know what to do. So let me ask you this before we go any further. Does men go through this?
There is a phenomenon called andropause. So androgen, male hormone, testosterone. Men do have a decline in testosterone as they age, and it does cause some mood instability. It does cause muscle loss. It does cause some sexual issues where the stamina may be decreased, and we have to give them testosterone replacement in the patients that it's safe to do so. So yes, it's the men do have a similar phenomena, correct?
Okay, good. So let me I have a few questions I just want to ask, just to educate everyone that's coming in. So my first question is, why do you think menopause is still such a taboo topic, even amongst women?
I think it's because of the lack of studies that was done. I think which equates to a lack of knowledge, right? We have more studies on erectile dysfunction, the menstrual cycle, PMS, and other medical issues. I believe that's what kind of increased the taboo, is because it's not a topic that we normally talk about.
Right.
For us women, I think there's a fear of feeling discarded by society, because in this society that we live in, if you're not able to produce, period, even the women that have issues with fertility, is almost like you're useless, you're a waste, you're done, you know. So there's a fear of that in the Black and Caribbean community. I know there's a lot of misinformation, and our grandmothers and mothers, they were not open about menopause. They didn't know how to even describe their symptoms. So I believe that's where it stems from, especially in our community.
Yes. It's interesting to know that, because I'm reading the comments from the people, and they're saying, "Oh my God, menopause is real." I have the circle that I'm around. Some are having brain fog, forgetfulness. They have to jot down everything. Is that part of the menopause, or losing hair?
Yeah, losing hair is one that I see a lot. And the brain fog, yes, we have issues with word retrieval and just memory, short-term memory. Yes, it does happen.
Okay. Wow.
And this is due to the lack of estrogen.
So what do they have to take? The doctor have to give them pills to?
No, as long as it's not progressive to the point where you're forgetting where you're going, like driving somewhere and you just lose your memory. We try not to treat, we try more to educate and to advise. And we'll talk more about like hormone replacement therapy and different herbs that we can use. But yes, it does happen. It's normally transient, which means that it's not progressive. It's not something that gets worse over time. But it is recommended that you read, you stay active, because that's what really helps with preventing progression of those issues.
Okay, great. Wow, this is so interesting. Okay, I'm going to ask you a few questions, and you can just elaborate a little bit. So, it doesn't have to be in order. How was the silence around menopause affected women, mental health, emotion, physical health? I mean, sorry.
The silence, repeat that again.
How has the silence around menopause affected women's mental, emotion, and physical health?
The silence. I think the silence causes more of isolation, more confusion. You know, it causes more, like, there's no support, right? And I'm proud to say that people like you are changing this with opening your platforms. I even see Halle Berry and Tabitha, the one that does the Dash, the seasoning, talking about their menopausal symptoms and their menopausal journey. So the veil is slowly falling off. As we all know, any issue that's hidden or dismissed can lead to mental health issues and a sense of isolation for people experiencing the problem. Medically, it delays treatment. And being dismissed by your healthcare providers also increases mistrust in the community as well.
Okay, wow.
Yep. So I think the silence is not helping us.
It's not. Okay. What about okay. What was your moment that made you realize menopause needed more open dialogue?
My aha moment, I would say a patient came in to me, and I think I brought that up a little bit in the talk. And she was utterly concerned about why her GYN just dismissed her. The GYN didn't take any time to explain. And at the time, I wasn't working in primary care. At the time, I was still doing cardiology. And she's like, she just dismissed me, you know, and I had to accept as a provider myself that there's a much needed dialogue regarding the topic of menopause. I think we as providers dismiss patients because we assume that they should know it's a natural process, right? But everyone's symptoms are different. So instead of pushing medications and instead of just dismissing them, just listen, have an open discussion where there's room for questions and validation. Like, yeah, you're having your palpitations. We put a Holter monitor on you. We see that you're having some early beats, but a lot of this is hormonal. This is what happens to some women throughout this time, this transition in life.
Okay, we have questions, but I'm going to answer. Okay, there's people texting. Like someone said, what is a lifestyle change can be made to reduce the symptoms? There's a few in here.
Lifestyle change. So lifestyle change is nutrition, watching what you're eating, processed foods, sugary foods, alcohol. Those increase the symptoms that you get during menopause. They increase the burden of those hot flashes with what you're eating. So I would say more whole grains, more fruits, more veggies, and being mindful. I think those are lifestyle changes that are important and simple.
Right. What about touching about dieting?
Diet. So again, just avoiding processed foods. Avoiding processed foods, fatty foods, fried foods, too much of that. The typical is pretty much like a cardiac diet, a heart diet. So because your lipids are increasing as you age, and you don't have that estrogen protection, your risk for heart disease has now increased in this transition in your life. So you really need to be on a cardiac diet, which is low fat, low salt, and just staying active.
Right. Here go another. I'm gonna go back to the question. You know, let me answer the question. Ask you the question, and I'll answer.
Yeah, and then you'll answer. Just because a lot of the questions that you have may kind of
yes, my answer to your question. So,
yeah.
Okay, what is the most ridiculous method about menopause you've heard, and how?
Method or myth?
Myth. Sorry.
Okay.
What is the most ridiculous myth about menopause you've have heard, and how would you debunk it?
I think it's the end of intimacy. That's the most ridiculous lie I've ever heard about menopausal women. And I've even heard it from women where they're like, oh, I went through menopause. It's almost like some women give up on themselves, or it's almost like the end of life in a sense. They don't have the youthfulness is gone. And the women that I surround myself with that are going through menopause have debunked that, because they have explained to me how they're still exploring, how they're still very, they have a high sexual appetite, and they are learning the new version of themselves. So it gives me also the motivation to know that you're not done, right? It's not over.
Right.
In Jamaica, them say you're done, the woman done. Once your age come off a calendar, you're done. No, you're not done. So I think that's the most ridiculous one I've heard.
Wow. Okay, here go another one. What symptoms caught you completely off guard, and how did you navigate it? Well, that could be anybody.
That could be anyone. But I had a hysterectomy a year ago, and due to fibroids, and I still have my ovaries, but my doctor was telling me that, you're not going to go through menopause because you still have your ovaries and you're still young and whatever. No. I am actively having flashes. I am actively having the brain fog. And what caught me off guard is the insomnia. My God. Now I know why my grandma would wake up 3 in the morning and cook, clean, make breakfast and dinner before 10 a.m. because I'm there.
Right.
I am up at 5 a.m. like a crackhead, busy because me can't sleep.
You can't sleep. Well, that's part of the menopause.
It's a part of it. It's a part of the perimenopause, the lack of the insomnia. A lot of the times you don't get to sleep. It's just something that clicks, or you get that flash in the morning and you wake up and you're like, oh, I need to shower. I'm sweaty.
Right.
Like I just
Yes.
wake up sweaty. So I've been using the soursop leaf tea, what my grandmother recommended, and
Mhm.
that's been helping me to sleep a little bit longer. So that's what I've been doing. But yes, insomnia is kicking my butt.
Wow.
Yeah.
Wow. That's interesting to know, It's very interesting. Okay. This is about wellness, healing, mind, body and spirit. What
Mhm.
holistic practice, yoga, meditation, herb, etc., has been a game changer for you or others?
Okay, so I'm a big yogi. So for me, yoga has been a game changer for me. Um, I think it's just having the balance of movement with
Mhm.
stillness, which I'm big about with my retreats. I feel like movement is life. Well, I know movement is life. Someone told me at my last retreat that that's the motion that gives you the lotion or something. It keeps your joints flexible. It,
Right.
it keeps your mind at peace. It actually helps me to sleep, and it gives me this boost of energy that no caffeine can give me.
Right.
So I think just movement, and the days that I don't do yoga, I walk, and it's not even a fast-paced brisk walk. It's just walking.
Right.
um just an hour, 30 minutes of walking. So if yoga is not your thing, you can do that. And that's what's really changed me. Praying and also meditating, taking time to feel, and not just trying to numb myself, working and studying and doing this thing and helping this person. Just really taking time for myself. And I think those are holistic practices that I've implemented in my life. I did some research on herbs, which my mom and my grandma had told me about. The primrose oil.
Hmm.
Primrose oil is a good one to help with your symptoms. And I'm research based, even though I do, I'm from Jamaica, so I believe in the herbs. So I like to do research on the herbs and find out what FDA and CDC and everyone else has, what data they have. And of course, there's limited research, but according to the FDA, the evening primrose oil is effective for the hot flashes. So grandma, mom was right about that.
Hmm.
St. John's wort is good. St. John's wort, pine bark extract,
Hmm.
the black cohosh. That's a good one as well, and I've heard that from numerous women.
What about Cersei?
Cersei is good for Cersei is more like a detox.
Okay.
Yeah. And then you have your phytoestrogens, which is like your soy products. But you have to be careful. If you have history of cancers, you have to be careful of the soy products. Because they secrete estrogen, they're phytoestrogens. And if you had an estrogen producing cancer, you don't want that. So you want to make sure that you talk to your doc about increasing soy in your diet if you are perimenopause and you had a history of any type of breast cancer or anything like that. Okay.
Yes. Okay. Okay, here's another one. How do you balance medical interventions like HRT with a natural remedies?
Okay, so first let's talk about HRT. So HRT means hormonal replacement therapy. So this is the treatment that they will offer you um, for menopause, like severe symptoms of menopause.
Mhm.
So HRT is normally when we talk about that is estrogen. So we're trying to replace your estrogen. We're trying to give you pretty much estrogen to alleviate your symptoms like hot flashes. It's really effective according to the research I've done in the women that I've met that are on estrogen. It reduces symptoms in 75% of women compared to placebo. So women that we give a fake estrogen, like a vitamin pill, they didn't feel anything. Women that we gave the estrogen to, 75% of them said, "Hey, I'm feeling way better." If you have a uterus, a synthetic progesterone, so another female hormone, needs to be combined with the estrogen to decrease the risk of cancer. Anytime you deal with hormones, you put yourself at risk for cancer. So we have to have a balance there. If you have no uterus like myself, then they'll do estrogen alone for you. And anytime we treat with hormonal replacement, we do the lowest dose for the shortest duration. I would talk to my healthcare provider that has your medical history, that knows your family history, your surgical history, your prior labs, and your recent labs, and they'll be the ones to guide you. Sometimes we even start with a little SSRIs. SSRIs are your Zoloft, and which is sertraline for depression. Sometimes we use that to help with symptom management for some patients as well. So it's not always hormonal replacement therapy. Sometimes we just want to help the patient get some sleep and be less irritable, and then we'll work on the hormonal replacement.
Wow. Okay, great. Okay, this is the emotional. Oh, wait a minute. Oh, what's the role does nutrition play in managing menopause symptoms?
Okay, so we touched on that a little earlier. So just avoiding highly processed foods. So I would avoid anything, those TV dinners, those things that comes in bags and packages. I would just get fresh vegetables from the farmer's market, support your local farmer's market, and just try to eat healthier foods with saturated fats, added sugars, excessive caffeine, excessive alcohol intake. Those will all make your symptoms worse. Spicy foods that us Caribbean people love, and hot drinks, like how I love my hot tea, those can also trigger hot flashes.
Okay.
So be mindful of that. Cigarette smoking is a major one as well, even though that's not nutrition, but people use that as a way for anxiety, and it's a part of their daily life, but that also makes your symptoms worse. So I would increase vegetables, fruits, and again, whole grains, and do a cardiac diet, a healthy heart diet.
Juicing.
Juicing is good. Yeah, getting your fruits and your vegetables. And sometimes we even have a little constipation too, with menopausal symptoms, things slowing down. So the juicing will definitely help with that.
Okay, great. This is the emotional mental health part. Menopause can feel isolated. How can you find or create a community?
Creating a community is important, and I am big on creating a community. I've created a strong community of women, mostly women. I have men in my community too, but it's a lot of women of all ages. So 20s, teens, all the way up to my grandma. My grandma she just turned 86, and she's literally my best friend. And I feel like we should all have a community, women and men, but especially us women. We need people that are open and honest, because this can help you traverse through the challenges in this chapter of your life, right? You're going through changes again, right? And some of us have adult children that we're navigating through their changes. So now you got changes on top of changes. So these women came into my life from women that attended my retreats, or women that I've worked with, childhood friendships, people that I met along the way. Some are older and some are just arriving. And despite my wealth of medical knowledge, it feels amazing to be supported and understood. So I would say seek support groups. You can literally Google whatever issue, diagnosis, symptom you have, and find a support group of people that are going through the same thing, that can hold your hand throughout this transition, or any other challenge that you may be facing throughout this life.
Right. Okay, let me ask you, because people are asking, where can they find the tea, that all the teas that you talked about?
Um, Teas. I would have to try to recommend someone. There's a high frequency tea. Is HIGH frequency, FREQUENCY and they are on TikTok, Instagram. The lady that owns the company, she actually works at she owns one of my retreat spaces, and she packages herbs and ships them across the world. If you want to get in contact with me at the end, we'll share my contact so you can reach out to me just in case you didn't get that. But it's high frequency tea. And I don't get benefit from it, but if you can get access to them, I want to support them as well. So that would be good. So we can touch base at the end. Okay.
Yes, that sounds great. Okay, this is another one. What coping strategies help you to manage like the mood swings, the anxiety, or the menopause range?
Okay, so coping strategies. For the menopause rage, yeah. I would say go into your toolbox of coping mechanisms. You've lived a life that you've had to figure out ways how to cope through challenges. So go into that toolbox. For me, it has been journaling, exercising, spending time in nature, meeting people, being honest, being vulnerable too. Like talking to people, women about my symptoms, and then you'll see other women open up like a flower, like, oh my God, I went through the same thing. Right. So we're not as unique as we want to think we are. Right. Sometimes if we talk, that connection is made and we get that support that we need. There's certain meetups they have. There's one called Brown Skin Brunching that's all over the country in the US and all over the world probably, where there's women that meet up and do brunch and talk and connect. Check out Eventbrite. Again, there's always different events, different seminars. Excuse me, I'm a city country girl. Check out Eventbrite. They have seminars and conferences and women that want to meet up and people that want to educate you.
And they talk about menopause and okay.
Yeah, and different things. Sometimes we have to get away from our current situation to be able to kind of take a break and look within, and also just find new hobbies and new things to do so that you can get out of your own way and get out of your own mind too,
Right. Okay, let me ask you another question. How can partners, friends, family better support women going through the menopause?
So friends, partners, and family should and can better support women, period. Mm-hmm. Period. Menopause or no menopause. And we should all support each other on a whole. Yeah. But during menopause, through this hormonal shift, take an initiative for your mom or your sister to come up with plans and ideas. Offer ideas, because again, brain fog is real. The depression comes and sometimes it stays and it visits, and anxiety comes and the irritability comes. Sometimes just invite your mom to the park. Mom, wear your sneakers. Let's stop at the park. Let's have lunch. Offer ideas for outings and dates. If you're a husband, pick up the children. If you have adult children or you are an adult child, be that support that mom needs or aunt needs or your friend needs. Give a break from the grandchildren. A lot of the adult children are dropping off the grandkids while mom is going through her mental breakdown because she's having all these changes. Give mom a break. Check in on mom too. She's not concrete. She is human. Give her a little bit, lighten her load a little bit more. And as women, we need to take rest days and get some massage therapy and spa days. And they don't have to be expensive. Look on different things and get discounts and so forth. What about buying her favorite tea or something she likes? And if you want to invite us out during this stage of our life, make sure the place has fans and ACs everywhere when we get there. Sit us close to the AC. Don't have me sitting outside when it's 100 degrees when my hot flash coming on.
Right.
Make sure the AC is close. And, I could bring a sweater. I could take that off. But if I'm hot, there's no cooling down. So just be realistic.
So even getting a massage is also helpful too.
Yeah, just relaxing. Just relaxing.
Does it help for the menopause?
It will help with just relaxing. Just help with just letting go for a little bit. Help with just kind of getting that reset, just that relaxation.
Because the reason why I asked you about men early, I've been doing hair for 39 years. I went through the hot flash. I would be doing a client's hair and I had to take off my shirt and put on another shirt, like I would take off my t-shirt and have my jacket on, we all wore jackets at the barbershop. And I'm like, why am I going through this hot? And I'm 56 now, but I already went through it in my 40s. I'm like, oh my God, I believe men go through the mood.
I believe so. I know about the mood and the lack of stamina that happens, but it's possible.
Yes. Okay, so I was going to ask about the sex and intimacy and relationship. You did touch on that earlier. Let's go on the professional and the social challenges. Should the workplace have menopause policies? What would they look like to you?
Okay, let's just backtrack. We could talk about sex. We're adults here. Sex is important. Sexual health is very important. It's a part of our health. Just like how everyone is talking about mental health, sexual health is important. So before we get into societal challenges, I want to talk about sex. So it is imperative to have the conversation about what you are feeling as a woman to your life partner. Surrounding intimacy. You want to talk about your emotional and physical changes. Are you experiencing pain during sex due to vaginal dryness? Be real. They have jelly for that, KY jelly. They have CBD jelly. They have, things that are edible that you can use to help to lubricate the vaginal canal and so forth to prevent you from having pain. Do you have a lack of stamina because of this decrease in estrogen? Are you struggling with mood swings where you're not in the mood at all? Talk to your partner and be open to discuss sex. Sex doesn't end because you're in menopause. Your sexual health it's important. So, seek medical advice. And sometimes it's okay if you need psychiatric care. It's okay if you need that antidepressant or that mood stabilizer to get you through this transition. Don't judge yourself. Give yourself the grace and be open to change because you are changing regardless. That's the only thing constant in this life is change.
Yes.
That's it.
Yes. So Terryan, let me ask you this. I'm going to go off script for a little. Tell us a little bit about your retreat because you went through transitioning and you've been a nurse. So you created Disconnect
and Reset. Yes.
Tell me about that because I love how you told me already, but.
Okay. So my retreat, I had the idea from about 2015, 2016. The goal was just to bring people that are explants of Jamaica, people like me that left Jamaica at 9 and 10, don't know nothing about Jamaica. People that are from different walks of life, different cultures, different countries, different backgrounds, and bringing them to Jamaica to embrace the culture, the nature, the place, and take time to unwind and recharge. And then the pandemic hit. And we were all locked in. A lot of people were not traveling, but I was traveling. I traveled a lot during the pandemic because I was working. I was working in cardiology at the time, covering 3 hospitals in a day. I would literally drive from one, get pages for that one. I was covering them and I would see patients and I burnt out. And I said, you know what? I'm gonna go to Jamaica for a few weeks and take some time. No resort space, nothing. I'm going home. And I went there and something just hit. Like I really was just going to the river, eating from the land, taking time for myself. That was the first time in my life that I had no expectations. I had no itinerary. I just knew I wanted to be in nature and I wanted to get back to myself where I grew up in the country as a child. And I went home and it changed my life. I came back recharged. I quit my job in cardiology at that practice. I found another position. And I was like, I need to add my yoga to it, movement, outside of dancing, because we do dance a lot.
Yes, you
Um, add yoga to it and share it
do.
with others. Share it with others. I've been through a lot of trauma in my life. I was a teen mom. I had my first child at 16, was homeless after losing my father to a massive heart attack at 17. And I had to pick up the pieces. And all I know is hustle, 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 survival, work, 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 work. And I know I'm not the only one. So I curated this space for individuals like myself that I don't want to plan anything. I will just pay and show up.
Yes.
And you take care of me. So we have our personal chef, 3 meals a day plus snacks, water, coconut water, your natural herbs and teas. We have daily yoga sessions that anyone can do. You could be a paraplegic, you can still do yoga.
Right.
Okay. And it's pretty much just a spiritual practice with stretching and body movement and periods of silence. At night, we meditate. We take time to listen to God. We're always praying and telling God, I need this, God. Dear God, do this for me, God. Sometimes you got to listen and let Him speak to you. So meditation is you just being silent with the breath and allowing God to speak to you.
Right.
And we do that at night. We stargaze. We really get back down to the basics. And our chef is great. We do plant-based farm to table meals. Everything comes from the farm. If we do chicken and fish, it comes from the people that raise the chicken. I support the locals. And we do workshops like this where we talk about different topics, menopause, trauma, being sexually abused as a child. We talk about childhood trauma in different ways and challenges that we have with our adult children and our teenage children. So, outside of that, we have a herbalist come in and teach us about the herbs. We have people come in and teach us on how to uplift ourselves, how to take care of ourselves. We have a massage therapist that comes, and I always schedule joy. So we're going to dress up, we're going to dance, under the stars, we're going to go to the river, we're going to cook at the river. And it's all about getting back to earth and getting back to how God made us and intended us to be in nature and not being locked into buildings with lights for 2 hours a day.
And be stressed out.
Yeah, so it's a good way to recharge. But then when you get back, you have a wealth of information about how to change your life and how to pause and reset, even at home. Take time for, in the bathroom, just take time for you and create that space for yourself, even if it's within yourself. So that's what my retreat is about.
It sounds beautiful. I need to go too. When is the next one?
You better come. I'm working on next May, and I'm thinking about Costa Rica next May. I've done Jamaica 5 times with amazing people. They're not just female only retreats. We have couples that come. We have young people that come, solo travelers. So yeah, May in Costa Rica. That's what we're working on.
Okay, sounds good. Sounds good. Okay, let me go back to these questions because we're gonna end soon.
All right. We could talk all night. We could talk all night.
Yes, we know. My cousin, everybody. Okay, so we did that at one already. What does the embracing the transition like?
You were sorry to cut you. You were talking about policies, like policies.
Yes. Yeah. Should the workplace have the menopause policy? What would they look like?
Listen, let's not talk about workplace policies. You see what's going on in this world right now. I mean, we live in a capitalist society, right? We don't even get a week off during our menstrual cycle, where some of us are having diarrhea, nausea, vomiting, and headaches. We barely get time home to be with our children after we birth them. Within, a few weeks, when other Europe, they give them months home. We get a few weeks home. In most organizations, some organizations, you don't even get time off. If you don't have that PTO, they don't care. So this is exactly why we have to choose self-care. We have to have a support system to keep us in check, to be like, no, girl, you're bugging, you're not looking well, you need help, and again, use your PTO, ladies. Don't hold on to the PTO for what? Use your PTO, your paid time off. Use it. Get your rest, live your life, and choose yourself. We're not going to fight these organizations to love us and support us. We have to take care of ourselves and have standards for our own self-care. So that's my spiel on, workplace policies.
Someone just said, I use my PTO.
Use it up. Use it up. Use it up.
Okay. Here go another one. What does embracing the transition look like to you? Did I say that?
Okay, embracing the transition to me, I'm not fully there, but I'm in the early transition. I'm finding hobbies. Now that my children are older, I'm finding hobbies, things that I didn't know I could do, or things that I was like, that's not my thing. I'm learning that. Swimming, pottery class, just simple things. And they sound like old lady stuff, like gardening and stuff. But listen, you can find joy in those simple things, and they're free. A lot of them are free. You could do them at the local college or volunteer, do something. So the transition for me has been finding hobbies, being open to pivot in life. Right now, I rented out my home and I am living in a whole other state. Because guess what?
What you living in?
I'm in Washington State and my home is in Florida. I rented out my home and I pivoted because of opportunities and because I got to work on me now, right?
Yes.
So this transition is also like a rebirth, right? Because if bleeding for over 30 years didn't kill me, what can?
Right.
What can? You know what I'm saying?
Yes.
Take calculated risks, ladies. Choose the life that you desire. Live in your truth. Stop suppressing the greatest parts of you and your deepest desires about, I'm too grown for that. I'm too. Enjoy life. You have raised the children. You have helped others. You're giving your all to these organizations and this country and this whatever. Take care of self. So for me, it's just really finding hobbies and pivoting and just embracing the newness of this transition in my life.
So let me ask you this is not in the question, but after someone goes through the menopause, because I've, like my circle, I've seen some going through it now, and I see people come out of it, lost their hair. What is the after they pass through the menopause and all that, what else happens after that?
What's next?
Get it out.
What's next? Now my vagina is dry. I done lost my hair. My memory is not the same. My bladder is messed up. What's next is, again, you embrace the now. You embrace the now, the fact that things are not functioning the way how they were at 21, but this is this version of me. So you work on yourself, you take care of yourself, and you meet yourself where you are. You get the support that you need, you get the resources you need, you seek medical attention for things that may be lingering, and stop trying to be hyper independent and the strong Black woman. It's natural, I'm gonna just go through this. No, they have options. Get the help you need. Take care of yourself. But it is a part of life. It is a transition in life. And we'll all of us females will get there if we live long enough. So what happens next is that we lube up and take care of ourselves and enjoy life.
And live your best life. Okay, I have 3 more questions.
You counting them?
No, yes, I've been. What's your main mantra for thriving, not just surviving menopause?
My main mantra for thriving. I'm not even going to attach menopause to it.
But it doesn't even have to be you. It could be your patient.
Right. So for us women, especially Black women, our default is surviving. We're always surviving, trying to find a way to survive and keep my head above the water. So I think the mantra should be, and for me, it's a work in progress. We only get one life. There's no test runs. You don't get to come back and try again. So just trust yourself, take care of yourself, and everything else will fall into place. Do the things that you enjoy, even if you're doing it alone. As my friend Farah Salon always says, my fellow nurse friend that I knew from age 11,
Right.
she says, you're not doing it by yourself, you're doing it with yourself. So sometimes we don't do things, we don't get out because I want to do it alone. Do it with yourself. Challenge yourself to try something new for the first time. Stay active, prioritize your rest, schedule joy, schedule a quarterly reset for yourself, get into therapy if you need to. And once again, lean into that community, because it's not about surviving. We really need to start thriving, especially throughout this transition, so that our children, our grandchildren can see the transition while it's happening too, that it is possible, and then life goes on.
Right. That's beautiful. That's a testimony right there.
Yeah.
Okay. Retreat special questions. What inspires you to what inspires you to create a retreat focused on menopause? I think we did talk about that.
Yeah, so we spoke about that. My retreats are not directly focused on menopause, because we do get different age groups. We have different topics that we talk about, and different workshops that we do, so that when you leave there, you leave with a wealth of information and data to bring into your daily life. It's not an escape of your life. It's not a getaway just to escape things and, oh my God, I need a break. It's really a reset and time to get information and to rest and relax. And my inspiration now, as I said before, is because of all that I've gone through and what I had to do to work on myself with therapy and working on my health overall.
Right. Wow. Okay. What inspires? Okay, hold on.
What you asked me. You asked me a
yes,
question about
I
inspiring.
did already. How does your disconnecting help women reset during the life stage?
How does disconnecting help women reset? I think just being away out of your comfort zone sometimes helps you with looking from the outside in. So you get to evaluate your life and see a different perspective when you step away. So I think disconnecting helps you to reconnect with your inner self, your true self. And it also helps you to expand your knowledge base, because you learn more about yourself, especially if you're alone and you meet strangers and you start to recognize certain habits you have and certain things that you do, and people point out things because they're getting to know you.
Right.
And it's just a beautiful way to learn yourself, and also ways to unlearn bad patterns that you have developed throughout the years and bad coping mechanisms that you've had. So I think disconnecting is a great way to recharge the soul, the spirit, and the body, because you'll be surprised. I have people that come and they say, I don't like yoga, Terry. I'm just coming just for the food and just to be out. I just need a break. And they leave and they're so flexible, and they'll call me a week later like, girl, I'm doing yoga now and I'm doing this now. And it's amazing to hear.
And also keeping a journal.
Yeah.
Having a journal and writing. What I learned in my side in therapy, having two journals, the things that you need to work on with yourself, and the journal where you see yourself in 5 years. So you write down, and even if you're going through the menopause, you can also write down the symptoms, everything that you're dealing with, to help yourself to be better.
Oh, that's a good one. That's a good idea. I don't have a journal for both, but I believe that sounds like a great idea.
The reason why I say that, because women don't come with a handbook. Being a mother, being a father, don't come with a handbook. If you wrote down the journey, or even this is the third one, writing down everything that you've been through, that can help pass down to your daughter.
That's true. That's true.
See, I just thought of that.
Yeah, that is true. Oh, look at you, Mr.
Okay, listen to this one. We did that one. How can attendees carry this empowerment into their daily lives?
How can attendees of the retreat bring empowerment? I think it's just by osmosis. I think once you're around the type of energy that we offer and that we bring, it's only natural for you to come back and be like, wow, I need to work on this, or wow, I need to implement this in my life. I believe so. I think it's just a natural process, and they bring it with dietary recommendations, things that they learn from the chef about how to prepare these plant-based meals, or these, whatever it is, these shakes, different yoga poses and the benefits of it. The way how maybe the room is designed, and they're like, oh my God, I should turn my bed that way. It's just a simple feng shui things, those simple things that you won't even think of. Once you get back home, you really hone into, wow, I needed this. So it's the small things that you learn, and I'm always excited to hear what other attendees have heard and participants have heard and what they have learned.
That's so nice to know. Listen to this, Terryan. Give your final statement before I close this show. Give your final encouragement to the women, how they can find you on whatever platforms you have. But I'm going to give you the platform where you can close out. And you got the floor, sister. Go ahead, cuz.
All right. I never know my trying to run away from social media, but we can't.
No.
So my Instagram is disconnect_reset. I can type it in here. Can they see when I type in here?
Yeah, I think.
Or it's just you?
I think I
put the high frequency T in there too. So it's high frequency T for the T's, and you can follow me and I'll direct you to them. But it's disconnect, DISCONNECT _reset, RESET. That is my Instagram, and my TikTok is at disconnect and reset. And you'll see a picture of me in a lime green tights set there. So on that site, on my TikTok and Instagram, you can get to my website. I haven't posted about Costa Rica yet because I'm still finalizing everything.
Mm-hmm.
But yeah, so again, my name is Terryan Douglas. I'm a family nurse practitioner. I've been in nursing for over 20 years. And I have 2 adult children. My son is 25 and my daughter is 20. And I am passionate about health and wellness. I love to make people better. And I always feel like everyone that have had access to me, or everyone that I have access to, they should walk away knowing that, yeah, man, I learned something from this lady, or, she touched my heart in a certain way. And I don't do it I don't plan it. It's just natural. And I feel like that's what our role is on earth. I always tell my kids, God could have made all the nature and forgot about humans. Mm-hmm. He didn't need us here. Or he could have made the world and just put one human per continent, right? But we need each other. And we should support each other. We should love on each other. We should respect each other. We should challenge each other to be better and hold each other accountable. So as women, I dare you to start taking care of yourself. I implore you to start taking a stance, to teach your children, to teach your daughters, your granddaughters, your sisters, how important it is to take a pause. Our mothers and our grandmothers functioned out of trauma. A lot of us are trying to unlearn the trauma that happened to us, or I could say for us, because as traumatic as have been in our lives, sometimes it's what gave us the thick skin that we have, that we're able to hold the lantern to lead others along the way. So yeah, so women support women, we'll support others, we support our men in our lives. Thank you again, Zay, for this platform. As a man, I appreciate that you even think of this topic. Like when you told me about this, I'm like, wait, what topic? Wait, want to know? Wait, want to know what business for?
Everything we want to know. Everything we want to know.
So we appreciate it. You know, this conversation needs to be had because you men need to understand us. You guys need to be able to support us, even if you don't understand us, be able to love on us and hold our hand while we're going through this change. Yeah.
Yes.
Yeah.
Everyone, I thank you for I just met my cousin and I love her already, you know. Bless her.
I love you too.
I'm gonna just be totally honest. When you said the 12, today made 8 years. My oldest brother, Sergeant Orville A. Howard, has passed through. So I was very lukewarm. I've been crying off and on, and then my girlfriend was graduating today, so it came in threes.
Wow.
Anniversary of 8 years. My girlfriend graduated from her CNA today. Bless up, Tracy Powell. I gave these big flowers and stuff.
Thank you.
And then I had to do the show. And I said, this year, Lord, I don't want to sit here and cry. I want to do something on an upbeat. So this is why when you said the 12, I was so grateful that you said you want to do it. But I just thank everyone that's tuning in. It's my 4th year on this show. And I want topics that are banging, that people can be educated, and when they watch it, they can pass it on to someone else. And so it can be, I believe in edifying the body. So you bringing me, giving you the topic, and we have a discussion will help everyone to know what they've been going through and how to embrace the change. Because men go through it. We go through it too.
Yeah.
So, I'm just thank you for everyone for tuning in with having a conversation with Zay. It's all about bringing the topics and the good conversations. And until next time, everyone, have a blessed, wonderful week. It's Father's Day is Sunday, I think.
I think so. I'm not sure. My father's been gone for a long time, so I don't be knowing. But yeah, I think so.
Yes. Happy Father's Day to all the men.
Happy Father's Day.
Some of the mothers that are doing the men's role too. But until then, everyone, thank you for tuning in to having a conversation with Zay. And this is where we just bring the empowerment and good topics. And have a blessed and wonderful evening, everyone. Good night.
All right. Thank you. Thank you all for joining. Thanks for the love and support. Blessings.
Bless up. Hold on.